My name is Maria Ruano and I am a medical doctor. I've worked for I-TECH for many years, and since 2020 I act as the clinical director of CRAM. At first glance, CRAM might look like a small and modest clinic, but in reality it is much more than an HIV ambulatory service. CRAM is located in the heart of Maputo, a city of more than 2 million people and the capital of Mozambique. Here, HIV prevalence among adults over 15 years is 16%. More than 170,000 people receive antiretroviral treatment across more than 40 primary health facilities in the city. Within this complex network, CRAM is a cornerstone. We receive transfers of patients, both children and adults, who face particularly complicated clinical situations. At CRAM, we act quickly. On the same day of referral, patients undergo essential investigations: laboratory tests, chest X-ray, ultrasound, and even retinoscopy when needed. The rapid evaluation allows us to decide immediately on treatment for opportunistic infections and follow-up care. Every month, we welcome about 50 new patients, and we currently follow around 1,800 individuals. Once their condition improves, they are decentralized back to the original health facility, ensuring continuity of care. CRAM specializes in Advance HIV Disease and serves as the reference center for Kaposi sarcoma, a cancer closely linked to HIV. With chemotherapy, Kaposi sarcoma can improve and even be cured. Each year, we provide ambulatory chemotherapy to around 140 patients.
Hi, I'm Gwambe, a nurse working at CRAM. Our nursing team cares for patients living with advanced HIV, many of them with Kaposi sarcoma. Beyond chemotherapy, we assist them in managing their wounds, ensuring they have everything they need to continue treatment and cover.
Without social support, treatment fails. Here at CRAM, many of our patients face huge challenges. We are talking about poverty, family abandonment, stigma, discrimination, unemployment, and isolation. That means they often lack the basics: food, money for transport, shelter, clothing. And when those needs aren't met, some lose hope and stop treatment. To keep them coming to consultations, we provide transport allowance for those in need.
A casa é esta aqui. O paciente vive aqui. Fernando, dá licença. Tia, como está? Também estou bem. Vem buscar aqui o Fernando. Queres que eu te levante?
Patients with mobility issues are brought in by ambulance.
Vamos levar.
Pode deixar.
Vamos comer lá. Devagar, devagar. Fernando, ajuda. Agora
For those on chemotherapy for Kaposi sarcoma or dealing with tuberculosis and severe weight loss, we arrange therapeutic soaps to help improve their nutrition. And we provide basic food baskets for patients with severe malnutrition because recovery requires food. For patients without home, we connect them with private religious shelters. Because at the end of the day, social support is what makes treatment possible and what gives patients a chance to rebuild their lives.
Our pediatrics team look after kids from newborn up to teenager who are referred to us when their disease is advanced or when treatment is not working well. We also bring in their parents and caregivers during the same consultation. We call this the family approach. So, together with parents and caregivers, we work on practical solutions.
Chronic illness doesn't only attack the body. Many of our patients arrive here broken, depressed, isolated, unable to cope.
More than 6% of CRAM patients present some mental health disease. As a mental health clinicians, We provide screening and follow-up using a structured approach that cover all the common mental health disorders that help them stay active in treatment and reduce the viral load.
CRAM is a pilot hub where new ID and HIV care are tested out. Here we are doing genotyping, studying drug resistance, so treatment can be more effective. CRAM is where evidence meets practice and practice shape national HIV policy. And it all starts with diagnosis. Every patient who arrives at CRAM enter the same diagnostic pathway. Starting here in the laboratory, the CD4 testing is the entry point. From there, the team runs integrated reflex testing, screening for opportunistic infection using cryptococcal antigen and TB-LEM, biochemistry, complete blood count, and molecular diagnostic using GeneXpert with a special focus on extrapulmonary sample. Same-day results so the clinical team can act immediately.
The main highlight is that CRAM is one of the health facilities with the highest number of patients diagnosed with drug-resistant TB nationally. In these 5 years, 151 patients with drug-resistant TB have been enrolled and successfully treated.
Chamo-me Felizmina, tenho 21 anos de idade. No ano 2025, fui detectada com tuberculose. Não foi fácil viver de 12 comprimidos por dia, não é fácil. Aquelas dores que eu sentia dia após dia, enjoos, vômitos, não foi fácil, mas graças a Deus eu já tenho 1 ano a medicar. E no dia que eu vim ao hospital, os doutores me receberam muito bem, que até nunca vou esquecer desse dia, do jeito como me receberam, porque eu estava mal, nem para comer, nem nada. Eu só vivia bem. Eu só vivia Deus, mas graças a Deus eu consegui. Tomei comprimido já tem 1 ano, só me restam alguns meses para terminar.
For more than 20 years, I-TECH has been working alongside Mozambique's health system, supported by the American people through PEPFAR. Back then, treatment options were scarce, and so many families and communities were impacted and felt the loss of a loved one. I-TECH began working at CRAM in 2021. From the moment you step in, you can see and feel what is possible when people from around the globe come together to tackle health challenges. CRAM's success and impact is a testament to the commitment of its extraordinary team of Mozambican health professionals and to the power of international collaboration.
Later in 2026, our I-TECH Mozambique country office will transition to a local independent organization called MZTech. And MZTech will be leading the work at CRAM together with the government of Mozambique. We look forward to continuing to collaborate with our friends and colleagues at MZTech to support CRAM. As we enter this next chapter, your support matters more than ever. I-TECH has established a special fund through the University of Washington where 100% of donations support direct patient services at CRAM. You can learn more about CRAM and other ways to get involved through I-TECH's and MZTech's websites. In a complicated world, CRAM is proof that when we come together across borders and backgrounds, we can make the world a better place, one patient at a time. We hope you'll join us.
CRAM is not just a clinic, it's a place of hope, expertise and healing. It's the very center of Mozambique fight against HIV.